In this presentation, I'm going to go over secondary surveys. So obviously our objective for our time together is to learn the steps for a secondary survey. Just a reminder, you're going to do this after the primary survey and you have ruled out all life-threatening conditions. No heart, they're breathing, they have signs of life, all those type of things have been ruled out. This would be the typical when you have an injury on the field and you need to go provide care for them. So there's on the field, it can be done at the sideline, it can be on the bench, or in ATR, which stands for athletic training room. Our goal here is to discover or recognize what injury the athlete has most likely sustained. We learn this by understanding the signs and symptoms, which we'll talk about a little bit, for all the different injuries that we're going to talk about in our class together. You're actually going to write an assignment where you'll use some of the steps in this lecture for the upper body and lower body injury assessment assignment. And so we want to do this in a logical and sequential method. And I'll talk about the common methods and what the textbook uses for methods. But first we need some terminology. First one is a sign. This is objective, definitive, and obvious indicator for an injury or illness, versus a symptom is subjective and is described by the athlete or the patient. So in the picture there, we have the letters in blue, which are signs, and the symptoms are in red. So if you look at the blue letters, we got temperature, moisture, heart rate, and color of skin. Those are all things that somebody else can see or measure. So we can measure temperature, we can see the sweat with the moisture, we can see the color of the skin, and we can take the heart rate. The symptoms are the things that the patient tells you about. I feel fatigued, I feel dizzy, I feel nauseous, and I have pain. Those are symptoms. So there are differences between those. We need to know what are some of the signs and symptoms for specific injuries or illnesses and those type of things. That's how doctors, physical therapists, athletic trainers determine what is wrong with a person by the different signs and symptoms. When you go do a blood test, that's a sign. If you tell a doctor I feel dizzy, that's a symptom. Or like me, I get migraines. That is a symptom. We don't know because it's a pain. You can't measure my pain. Well, we have pain scales, but it's still a sign. Again, diagnosis is denoting what disease, injury, or syndrome a person has or is believed to have. Doctors, not athletic trainers, make diagnosis. Okay, athletic trainers make an evaluation or an assessment of an injury. We do this by recognizing the signs and symptoms of an injury or illness. There's really a fine line between these two. Really, it's for insurance's purposes. Doctors and nurses also, and nurse practitioners and PAs, physicians, assistants can make diagnosis. As an athletic trainer, I do make a diagnosis, but legally, I can't say that. I can only say I evaluated, I think it's this particular injury. Then the physician that's supervising us will say, yes, I confirm that. Okay, so the injury evaluation sequence, I have 3 on the screen that are typically used in the medical field, especially in athletic training. Hops, hips, and SOAP. The H's are the same, the history. We're going to talk about what that means. The O and the I in hops and hips are the same thing, or observation or inspection. Palpation is the P, and S is one special test, one stress test. I'm going to talk about what those things stand for in just a minute. SOAP is a little bit different. It's probably one of the more original injury evaluation sequence that has been used. Subjective would be everything the patient tells you. This would be part of the history, what they tell you about their injury. The objective is anything that you can see, touch, or feel. That's the objective side of things. the assessment. This is what's wrong with the person. This is what I think the injury is. And the plan is what's the plan for the rehab or the treatment to get them back to normal. The textbook uses HIT, History, Inspection, and Touch. And for the assignment in our class, you're going to be using the History, Inspection, and Touch. Let's talk about what is our history. Most of you have probably been to a doctor or been injured or those type of things. You probably had a history taken by a medical professional. What we're trying to figure out is what happened. So we focus on past and present injuries. Have you ever had this before? What happened? Can you tell me what happened? Those type of things. Again, I'll talk about later in this particular part of the history. We ask a lot of questions in the history. What we really want to do here with our history. This is the thing that we're trying to zero in on, because when we're doing an injury evaluation, we're like a mystery detective. We're trying to take all the clues from the mystery and trying to solve who done it, or for us is what happened. So we're trying to determine what happened. And we call this determining the mechanism of injury, because for most injuries, especially in athletics, when I'm watching a sporting event on TV and somebody gets hurt, and I'll watch the replay and watch what happens to the body part, and I can tell probably 90% of the time what injury has happened by just looking at what happened. Or more recently, my mother-in-law got a call from her sister that her son, so my wife's cousin, was jumping off a boat, and he felt a pain in his lower leg. And I said, well, he's plus 40 years old. He's either got an Achilles tear or he's got a really bad calf strain. Just by knowing how the injury happened, we can almost determine what kind of injury this person has had. That's what we're trying to do in the history section. We also need to discover where exactly is the injury location. If you've ever done this, can you point with one finger where this hurts the most? And be very specific on where that hurts. What kind of pain does the person have? We try not to what's the word? I'm going to give them leading questions. Like, some of the types of questions that are typically asked that are probably not the best questions. Was it a sharp pain, dull pain? I like to ask, does your pain get worse as you do stuff, or does it get better as you start doing stuff? Because that typically tells me if it gets better as they start warming up, that means it's probably some kind of tendonitis or itis type thing. But if it hurts no matter what, that's going to be more of an acute type injury. So that's what we're trying to determine, is an acute injury or a chronic injury. So we haven't talked about this. I think it's in your textbook and some of the things that you've been doing in the online course. Acute is an immediate injury, automatically happen right then and there, ankle sprain, for example. Chronic injury, something that's been going on for a while. So any of the tendonitis type injuries are chronic, and we can tell the difference if it's acute or chronic by the mechanism of injury, how it happened, but also by the pain, because pain is different for acute injuries and chronic injuries. And how severe is the pain? The pain scale, 0 being no pain, 10 being the worst pain you've ever experienced. Where's your pain at? So again, a lot of you have probably had a history taken. If you've ever seen a doctor, physical therapist, or an athletic trainer, or any other nurse, any kind of healthcare professional. Again, as I said earlier, this is done by asking tons of questions. Again, we want to have these questions to be open-ended, which means that they have to be able to say something. This is not a good example of an open-ended question. Have you ever hurt this body part before? Yes. If so, when? When did you hurt it? And you're constantly following up and asking more and more questions. This, in my opinion, and I've been doing athletic training for a long time now, this is the most important step in the injury evaluation process, but it's the most difficult to develop, because you got to have a lot of background knowledge, knowing a bunch of things about injuries in order to ask the appropriate questions. And when you're new into the medical profession, you don't have that experience, you don't have the injury background, you're still trying to learn about all these injuries, like taking a class like this. So it just takes some time to do this. It's just practice, 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 and getting better at it. Next step is inspection. This is looking at or taking note of any abnormalities. So we are going to look for swelling, limping, facial expressions, deformity, lumps, skin color, discoloration, etc. What we want to do is do this bilaterally. What that means is you're going to look at the good side and compare it to the bad side. Can you see the swelling? Is it black and blue already? Can you see a obvious deformity from the muscle being ripped? So you're just looking to see what you can see. Again, this is another clue in our injury mystery. Next one's called touching the athlete, or palpation is what the medical term for us is. We're going to touch the bone first and then the soft tissue, muscles, tendons, and ligaments. We want to start with light pressure away from the side of pain, because you don't want to go straight to where they're in a lot of pain, because they're never going to trust you if you do that. You need to work your way towards the site of injury, because you've already asked them where exactly that injury is at. And what we're touching for is abnormal gaps in the joint. You can feel the swelling. You can feel deformity. You can feel those lumps. You can feel muscle tightness, and you can obviously feel pain. Again, we're going to do this bilaterally again. We're going to touch the good side and then the bad side and compare the differences between the two sides, because we always want to check the good versus the bad. Again, this is another skill that takes time to learn. This is why you take anatomy and physiology and a bunch of other classes like that. So you should become the expert in the body. You should be able to visualize what's beneath the skin. Where are those bones? Where are those ligaments? And where are those tendons and the muscles? Where are the muscles? Your fingers get really good at knowing where to touch, how to touch with practice. The next area is special test or stress test. The picture is showing there is a drop arm test for the rotator cuff. It's just one of many types of special tests or stress tests. These tests are designed to detect specific injuries. So that test on the picture is for a rotator cuff tear or a strain. So there are many, many different types of special or stress tests. They include some of the following types of tests we do. So we do range of motion testing, where we have the patient move their good arm first. Let's say we're doing the arm, we'll have them do arm flexion extension with the good arm, then do the bad arm, see if there's any difference in the range of motion. We do this both in passive and active range of motion testing. We do muscle strength testing. We then again compare the good area to the bad area, see if there is some decrease in the muscle strength. We can do a neurological exam, where is there a difference in the sensation that the person is feeling because of the nerves that send signals to that particular area. So that's neurological exam. We do these joint stability tests. This is stuff like for the ACL in the knee. We can do a Lockman's test or anterior drawer test. And we also do functional tests. How far can they throw, and all those things. Again, our goal here is to determine what specific injury that athlete or patient has, so that we can provide the appropriate care. What kind of rehab do they need? What kind of treatment do they need, so they can get back to playing their sport in a quick and safe manner.